Good afternoon, everybody. Kristine Varkony here in the NBC4i Streaming Center. I'm joined today by Adrienne Robbins, and our data journalist Ben Orner will be joining us shortly here to talk about the COVID-19 numbers in our data suite that we have on NBC4i.com. But first, I wanted to talk to Adrienne, our State House reporter. She has been covering the pandemic since the very beginning. Adrienne, I remember, crazy to think about, 8 months ago now, we were in a tiny room at the State House with a bunch of reporters, me and you both. And that was kind of the beginning there. Dr. Acton was there, a bunch of people from the administration, and now we are here. Governor DeWine giving his second statewide address of the pandemic after record-setting numbers the past few days. What do you expect that we'll be hearing from the governor this evening?
I think it's kind of hard to guess at this point what exactly he's going to be saying. If we look at his last statewide address, this kind of fireside chat style that he's going to be doing again today, he gave Ohioans a stark warning. That was back July 15th, and he told us if you don't change your ways, we were going to end up with, as states that we were seeing at the time, Florida, Texas, we were going to end up like them. And he just kind of gave that harsh warning. If you remember, a couple days later, we ended up with that statewide mask mandate. But I think he started that night, or at least said early on, I know many people are wondering about a shutdown. We won't be talking about that tonight. Orders are for another day, but it's kind of yet to be seen if that's the style he'll take tonight, or if we could see more shutdowns, or at least more requirements coming down. It's crazy to look back. I remember that was a time where our numbers seemed pretty scary. At the time, we were seeing about 1,300 cases a day. Now, about 6,500.
Absolutely. Adrienne, you've been covering this since the very beginning. Does anything feel different about this press conference at all, or what is happening right now?
I think previously we were always warned what could happen with our hospitals. Now we are hearing from those hospitals, and they are saying it is happening now. Our biggest concern has always been our hospitals, them not having enough staff, enough PPE, or enough room to treat patients that are coming in. And what we heard from Monday from quite a few hospitals is we are starting to see that trend happen. And as we know, our hospitalizations are kind of a lagging indicator. Those come after our case numbers. Those people kind of end up with COVID-19 for a while before they ultimately need to be hospitalized. And that's a scary thought to have when we're seeing those case numbers go up and up and up, and where we could be in a month from now if things don't change.
Yeah, it's interesting. I know a lot of people, the last time we had this kind of press briefing, a few days later, we saw the mask mandate that many people hate. Others had been begging for it for many months. And now it kind of seems like people are getting a little bit lax on it, and we're seeing the governor says these cases that we're having are from informal events, not places like schools, not places like restaurants and bars or shopping. It's the little things that people are doing without masks, gathering for OSU football games, having a family wedding, a funeral, etc.
Yeah, it's interesting because I see a lot of people, and I'm sure you do too, get messages of, why doesn't he shut things back down? Why don't we see more closures if we're going to see case numbers like this? But from what the governor has been saying is our case numbers aren't coming from bars and restaurants. They're not coming from the shopping malls being open and things like that. They are coming from those informal gatherings and people becoming pretty lax. And if you have heard any of the governor's COVID-19 briefings over the past couple of weeks, you've heard him give stern warnings to people to take this seriously, buckle back down. He understands that people are tired and they do have that kind of pandemic fatigue, but he's been asking people for 2 weeks, and we still see these case numbers going higher and higher. So what more can you really do than to just ask people to be more careful?
Yeah, it's difficult because they're drawing on people's sense of self-responsibility, and that in the United States is not something that can be governed. Everybody's got their free will, but I anticipate him coming on and really just yet again kind of trying to appeal to people's sense of community and protecting the elderly and our hospitals, because we're here, like he said on Monday, the hospital association, we're just a few weeks out if we keep on this trajectory from overcapacity at our hospitals, which is a scary thought. I'm reading some comments here, and I know we're working on a story today, people who are waiting many hours and are being turned away. I just read a message, somebody was turned away from a hospital due to overcapacity. And of course it is flu season. We don't know all of the, what people are being admitted for as well, but something definitely to keep in mind as the governor is speaking tonight.
Yeah, we're certainly at a pivotal moment. Obviously, temperatures are going to be dropping. We've been really lucky over the past week to have warm temperatures, but they are going to start dropping, and people then start going inside. We're also coming up on holidays. No one wanted to think a couple months ago about the fact that we may not be able to have a Thanksgiving or even a Christmas, and now that's kind of becoming a reality that people are going to have to change the way they celebrate those holidays if they're going to do it safely. So we're certainly in kind of a pivotal time for our state as we see these case numbers rise. But again, if you listen to the governor over the past 2 weeks, he's been sending a message like this warning message. So it'll be interesting to see how he changes his message tonight and how he plans to actually get through to Ohioans who he hasn't gotten through to quite yet.
Adrienne, this evening, will the reporters be able to ask any questions, or is this just a true address, no questions?
I don't believe we're going to have questions tonight. I have not heard word from the governor's office yet, but if you look at the last fireside chat kind of statewide address that he did in this fashion before, he said he would answer questions the next day. So that's a possibility that, tonight will just be the governor speaking to Ohioans, and tomorrow he may still have his COVID-19 briefing. But again, it's yet to be seen, but that's just looking at how he handled things back in July.
Yeah, it's a scary time, and it affects everybody. I know personally, as of tomorrow, Thursday, we're 2 weeks out from Thanksgiving. So if you and your family, you can do things to protect yourselves. We were talking to doctors. I will be, besides working home, I personally will not be going anywhere else. That's, I value spending time with my elderly family. I know my mom will probably kill me for saying that, but she's in that age range. But I'm going to be doing a self quarantine outside of work and home. That'll be it for me. So certainly something that Ohioans need to listen to tonight after hearing from our medical officials on Monday, kind of painting that grim picture of what is happening in our hospitals right now.
Absolutely, and especially if, like you were saying, if people do want to see their family in a couple weeks here, that's something they need to start thinking about. Is everyone has gotten lax. I think we're all guilty of one thing or another, maybe going out to a restaurant when we know it probably wasn't the safest thing that day. But I think that's what the governor is trying to rein back in is, we flatten the curve, as they say, before. And he said, we could do this again. We're seeing a big spike right now, but again, it's not too far gone. And but it's difficult, and it's hard for those people who are, again, they're tired of the pandemic that we've been in for now about 8 months. It's crazy to think about.
Yeah, it certainly is exhausting. It's exhausting for all of us. I'm sure, Adrienne, in March, you didn't think that we would still be doing this as the holidays rolled around. But we'll let you go. I know you're very busy. And we're going to bring in Ben Orner. I appreciate you being with us, and make sure to tune in tonight. Adrienne will have live reports probably all night long from 4
throughout the night over at the State House.
Yep, at the State House she'll be there. All right, Adrienne, thank you so much. Let me get Ben queued up here. You're good to go out of the frame there if you want to hop down. I'm gonna, like I said, bring in Ben right now. Just give me a moment to get him pulled up on Zoom. But while I'm doing this, just a reminder that we can do simple things every single day to protect ourselves. Washing your hands constantly, wearing your mask, no matter where you are in public. If you're passing somebody, give them space. If you're outdoors walking. Here's Ben Orner right now. Ben, thank you for joining us. A lot of people enjoyed our discussion yesterday about the numbers from the election. So let's talk about the COVID numbers in our NBC4i data suite that we have on our website. What have you been seeing the past few months? You collect these numbers every single day and analyze them. What's standing out to you right now?
Well, let me share my screen here. Let's see. Share.
Ben's going to share his screen with us, guys.
There we go. You got me?
Yeah, we got it. Perfect.
Excellent.
Let me go full screen for you.
I can do it on the visualization here. Boom. All right, you got that?
Yes, I just meant on our program that we have right here.
Good.
All right, now it's full screen for everybody to take a look.
So this is our COVID data suite on our website. So a few things that I've noticed. You guys talked about hospitalizations. That's in orange. Deaths in black, and cases in red. Hospitalizations, obviously, one of the biggest, probably the biggest peak that we've seen in this pandemic. Very reminiscent of what we saw in July, and now just getting even worse. But before hospitalization, someone is a case, and I think the starkest thing that I've seen is just how high cases have been in October and November. This chart and its boundaries, they change every day. So, if we got a day that was 6,000, then, that would go up. One note though, these are the days that people got sick. So, we reported 6,500 cases, or the state reported 6,500 cases yesterday. Is that correct?
Correct.
Something like that. So, that was November 10th. Only like 43 people actually got sick that day. This is how the state organizes it, as like when people first showed symptoms. So, to get that little note out of the way, 5,000 people got sick November 4th, another 5,000 on November 5th. And, we used to talk about how bad the July peak was. If we look back then, July 8th, 1,600, 1,800 people got sick on July 13th. That seems, those are huge numbers, but they seem so small compared to what we've seen in October and November. And, those cases, a lot of them turn into hospitalizations, and then hospitalizations turn into deaths. And you're talking about lagging indicators earlier with Adrienne, and deaths are the ultimate lagging indicator. I always go back to a Harvard study that showed that deaths occur. Well, the site has reloaded on me. Deaths occur about 2 to 8 weeks after someone first shows symptoms. And, when we were going up this peak in October, deaths were still going down. They were still kind of flat. And people were thinking like, well, what's going on here? Well, deaths are now kind of starting to catch up. They were going down in August, September, and then right around October, they go up ever so slightly. 11, 15, 18, 21, 24 people died on November 1st. I will note that 14 days previous are preliminary and expected to rise as death certificates, positive tests come in, and those dates lag. So this is about where we are now, about 14 days. So these, the deaths will continue to rise, and as we get more cases, as more people are hospitalized, more people are going to die, and we're going to see it.
You hate to hear that. I mean,
Yeah.
the terminology of deaths catching up to cases, that threw me there. And
Yeah.
I mean, there is a human element to it. These aren't just numbers, these are humans. Every case is a person.
Yep.
So we want to remind everybody of that as we are going through the data, as we are going through the numbers. Every case, every number is a person. So we never want to say only 45 deaths happened on that day. That is 45 people who
Exactly.
live in Ohio. Those are 45 family members. And frequently, because of how the virus works, it can be multiple people in a family. We've heard plenty of stories about that, and it really just breaks your heart.
Yeah, that's a great point. We talk about, only 24 people on November 1st compared to, 64 on April 28th. Those are 24 people who aren't going to be at Thanksgiving in a few weeks. 24 families, and that's really hard. And this, I don't know, the virus really takes a huge human toll. And as we see deaths increase, we don't know yet if it's going to be on the level of what we saw in April. The highest we had was 64 people died in a day. The whole country was less prepared. in the spring, we didn't know as much as we do now about this
Certainly, we have
virus.
remdesivir now, a variety of things.
Exactly. And so, the July peak was a little better, even though, dozens of people were still dying every day. So, because deaths tend to occur 2 to 8 weeks after someone gets sick, we're not going to know until probably December, whether this is a spike like we've seen before, but it's still an increase in deaths, and we're just starting to see it. And we know cases are skyrocketing. We know hospitalizations are skyrocketing. The next indicator we're going to start to see rise is deaths. So that's something people should watch out for. And keep in mind, like you said, that a case is a case, a hospitalization is a number. You can think of it like that, but especially a death. I mean, that's a person, that's an Ohioan, that's someone who lives maybe near you who died from this and won't be at Thanksgiving.
Ben, let's scroll down to hospitalizations, because that's something that we really wanted to focus on this week, because of the press conference that was held on Monday with the Ohio Hospital Association. And just take a look at those numbers right there. Can you kind of break those down for us and what you're seeing out of those trends?
Sure. And I think the best way I can show that is through a little table I created at the top, using the data analysis tool I use. So these are cases. It's basically the numbers in the data suite, but they're categorized.
Broken down for you to
exactly.
Yeah.
So here's hospitalizations here on the right. These are the way the state categorizes them is by admission date. So on October 30th, 161 people were admitted to the hospital with COVID-19. And to put it in perspective, like you asked about how this peak is, the top, November, October, the top 13 days that people were admitted to the hospital have been in October and November, especially late October. And if you think about that, you think about how bad this thing was in the spring and the summer, and how worried people were, and how health officials were really the hospitals are going to fill up. You need to take precautions. This is a serious thing. It's remarkable to just put your head around this and think that the worst of the pandemic, of this entire almost year-long pandemic, is now. That the top 13 days of people being hospitalized happened just a few weeks ago, and are currently happening now. You see November 5th, November 4th, and I'm sure November 11th will be here somewhere once those hospitalization numbers come in, since they lag by a few days. It's just remarkable to think about that we're living through the worst of it right now.
Absolutely, Ben. And if you guys have any questions for Ben on the numbers, please ask them. He's a really good resource and is really good at kind of breaking down and showing people any questions that they have. So if you guys want to take a minute and ask Ben any questions about these numbers, let's show the key metrics on hospitalizations, Ben, that you have from the Ohio Department of Health, and let's take a look at those numbers. This is the graph that Governor DeWine uses in his press briefings.
Yep. You can obviously see the trend, many days going over that sort of average trend line that he's got there. And, it's like the governor has said repeatedly for, I don't know how long, probably for a good month during this peak, that this is serious. People need to take it seriously. The data bears it out. And I think, when we start to see a trend start, so like when we see there might be a peak coming right now, it's easier for people to think, and people should think and be skeptical. Think all right, let's let the data tell us what's happening. And after about a month and a half of this, early October to now mid-November peak, and the governor showing us these kind of charts every day, and now hospitals are filling up, at least every 2 days, Tuesdays and Thursdays.
Mm-hmm.
We see it, and we now definitively know that hospitals are, we see stories, hospitals are having trouble staffing. They're seeing the increase in people because we see it in the data.
Yeah, certainly, something we always want to keep an eye on. And you can see the ventilator capacity and the ICU capacity. It looks good in the present. Those are present day numbers and more so a snapshot of the past, correct?
Yeah. The things will lag, and right now, I keep going back to the spring,
Mhm.
where we were more unprepared. The entire country was less prepared than it was now. But you know, if you look at it here, these sort of this capacity and COVID patients, so still a small share of capacity here, but it's going up. And we don't want it to increase to the point where hospitals are scrambling and they have to turn a whole bunch of other people away. It's not, I don't want to doom and gloom too much right now, because the entire country is better prepared to handle COVID than it was earlier in the year.
Mhm.
But we see the trends in the data, and if nothing changes, if behavior doesn't change, if certain responses by officials don't change, whatever your view is on who should take responsibility for curbing the virus, if nothing changes, then we're just going to see the numbers increase. And like we've been saying with deaths especially, that takes a human toll at the end.
Certainly. And like Dr. Amy taught us many, many months ago, this is a logarithmic spread. So the more people that get it, the more people that get it in turn because of the R naught number that she talked about. And we've been seeing it spread at different events like weddings, like parties. I mean, for example, we can go back to the Rose Garden announcement for their Supreme Court Justice, now Amy Coney Barrett. That infected many, many people, and that's where it is happening. And, one person can spread it to many people if nobody is wearing a mask or keeping a distance at these informal events, like the
Yep,
governor has been talking about. So the more cases, more equals more because of how a
exactly.
virus spreads.
Yeah.
Ben,
If you
there's
think
probably a
about it,
math number or a math term for that. My calculus knowledge is dried up. What is
the best way I can explain it is, let's say right now, like tomorrow, maybe maybe you have it, you're like you're not showing symptoms yet because the virus can you can be a carrier or whatever for a week or two before you start showing symptoms.
Yeah, and
So,
Ben, if you want, you can turn your camera back around if
oh
you
sure, let's see, stop share.
probably a little bit easier for people to
How's
understand. Yeah.
that? You
There
got
you go.
me?
Yeah.
Excellent. So yeah, so the best way to think of it is, and this is one reason why health officials tell us to wear masks,
Mhm.
is, you go to a party or you go out to the grocery store or something, and you're not wearing a mask, and you sneeze, and sure, maybe you try to cover it with your arm, but you don't cover the whole thing, and there's four people around you, and those four people may have just gotten in contact with the virus, and then let's say those four people sneeze without masks, and then it becomes 16, and it becomes 64, and it's just it's exponential. And that's just the nature of the virus, and one reason why the governor stresses masks. Now, there's a lot of people who want him to be stricter with masks, so we don't know exactly what to expect from this address he's going to have at 5:30. Is it going to be a statewide mask mandate? What's going to happen? We don't know. But certainly, I think a lot of people, at this peak right now, that will just get higher if nothing happens. They want him, or they want officials in general to take more action. And I know the governor's really been stressing personal responsibility for weeks, I think, telling people, hey, we need 80-90% mask wearing across the state.
Yeah, certainly. Yeah, and I see some questions. They are really questions that I can't answer. They're more so questions for the governor and different public health officials. I just wanted to see if you guys had any questions on these particular numbers that Ben could answer based off of the data. I can't really answer like anecdotal or what if questions. So if you ask the question and I'm not answering it, that is likely why. So we're going to end this here. Ben, we appreciate you being with us this afternoon. Always really enlightening to take a look at the numbers. I will make sure to post this entire preview of tonight's press conference of Governor Mike DeWine here up on our website in just a few minutes. And make sure you tune in tonight. Adrienne will have live reports from the State House starting at 4 on First at 4, and then she'll be there all evening. And of course, we will bring you that press conference live as well at 5:30, as well as on NBC4i.com and our broadcast platforms. Bye.